Right, so get this. You wanted to know more about ultra-processed foods and diabetes risk. Right.
Yeah.
You sent over this massive study. It's got data from almost 200,000 people in the U.S., and they were tracked for 30 years.
Yeah.
Those are the famous nurses' health studies, plus the health professionals' follow-up study.
Yeah.
Those are big ones. So
Those are big ones. What's cool here is that it looks at whether all that convenient, grab-and-go food is actually messing with our chances of getting type 2 diabetes. 30 years of food diaries, so.
That's a gold mine.
It's a gold mine of information.
Okay, so before we get into all the juicy findings, let's break down this whole ultra-processed thing. I mean, isn't everything in a grocery store kind of processed in some way?
Well, that's where this NOVA classification system comes in.
Yeah.
So picture yourself walking down a grocery aisle.
Okay.
You got your fresh produce, fruits, veggies. Those are minimally processed, right?
Right.
Then there's stuff like oils, grains, even your spices. Those are processed culinary ingredients we use to make food taste good.
Like the building blocks of cooking?
Exactly. But we're not talking about those, are we?
No, we're not.
No.
Yeah.
Further down the aisle, you've got canned goods, some cheeses, things that have gone through a bit more processing, but are still basically recognizable as what they are.
Okay.
But the real star of this study is the ultra-processed stuff. So think packaged snacks.
All right.
The sugary drinks, instant noodles, ready-to-eat meals.
Okay.
Think long ingredient lists, stuff you can't pronounce, often designed to last on a shelf for ages.
Okay. The siren song of convenience.
Yeah.
But did they find a link between eating a lot of this stuff and diabetes risk?
They did, and they were really careful about it.
Right.
They used some pretty sophisticated statistical methods to make sure it wasn't just that people who ate more ultra-processed foods also happened to be, say, less active or had a family history of diabetes. They really wanted to isolate the effect of those ultra-processed foods.
So what did they find after crunching all those numbers for 30 years?
Well, basically, the more ultra-processed foods people ate, the higher their risk of developing type 2 diabetes.
Okay.
And for every 10% increase in ultra-processed food intake, the risk shot up by 15%.
Hold on. I need to grab my notepad. 15% just for eating a bit more of that processed stuff.
Yeah.
Yeah.
It's a pretty big deal.
Yikes. But didn't you say they looked at specific types of ultra-processed foods too?
Yeah, absolutely. It's not like all ultra-processed foods are created equal.
Right.
For example, refined breads.
Okay.
The sauces and condiments loaded with sugar and salt, the sugary drinks, those were all linked to a higher risk. Same with those ready-to-eat meals.
Not so convenient for your health, it sounds like.
Not so convenient now.
Okay, that makes sense. But there was that kind of curveball, right? Where some ultra-processed foods were actually linked to a lower risk of diabetes. What was up with that?
Right. They found that ultra-processed cereals, specifically the whole grain ones, were linked to a lower risk.
Okay.
Also dark and whole grain bread, and even some packaged snacks. Now, it gets a bit tricky here because we don't know for sure if it's those specific foods that are protective or if it's something about the people who choose them.
So maybe folks who are already health conscious are reaching for those whole grain options.
Exactly.
Kind of a chicken or the egg situation.
Exactly, but still it shows you can't just lump all ultra-processed foods together. There's nuance here.
It makes you think twice about that everything in moderation mantra.
It does. And to make extra sure these findings weren't just a fluke, they actually teamed up with scientists across Europe.
Okay.
And combined their data with 4 other massive studies.
So they called in backup from across the pond.
Yeah, it's called a meta-analysis.
Okay.
And guess what? It confirmed their initial findings. More ultra-processed foods, higher diabetes risk. No two ways about it.
All right, so we've established that not all ultra-processed foods are the bad guys, but overall they seem to be messing with their blood sugar a bit. But let's be realistic here. This stuff is everywhere.
Right.
It's convenient. It's often cheaper. And those marketing people are good. They really know how to make it tempting. So what can we actually do about this? Do we need to, ban all ultra-processed foods?
I don't think we need to go that far.
Okay.
Remember, some ultra-processed foods can actually be part of a healthy diet. It's more about kind of shifting the balance.
Okay.
Creating a food environment where it's easier to make the healthy choice.
Right. So if you walk into a store, the fresh produce is front and center, beautifully displayed, and all those ultra-processed snacks are, hidden on a dusty shelf in the back somewhere.
Yeah. Wouldn't that be nice?
I know, right? Wishful thinking.
Maybe. But hey, we can dream, right?
Uh-huh.
But seriously, though, it's about making those fresh, minimally processed ingredients more affordable and accessible to everyone. So think farmers markets, community gardens, even just better stocked produce sections in your regular grocery stores.
Okay, I like that. But what about all the confusing labels and all the marketing hype out there? It feels like sometimes you need a PhD in food science just to read an ingredient list.
Oh, I totally agree. Wouldn't it be great if those food labels had a clear, level of processing indicator, maybe like a color-coded system, green for minimally processed, yellow for moderately processed, and red for all that ultra-processed stuff.
I love that would make things so much easier.
Right.
What about all those ads, though, that target kids with, sugary cereals and all that junk food? It's like, even I fall for that stuff sometimes, and I'm an adult. It's like, they're in our heads.
It's a huge problem, and I think we need stricter rules around how these unhealthy foods are marketed, especially to kids. It's not about taking away anyone's choices. It's about trying to, make things fair so that healthy options can actually compete.
Okay, so we've got some good ideas on how to make things better, but how do we actually make this happen? I mean, it seems like a really big challenge.
It is. It's systemic change. We're talking about shifting how food is grown, produced, distributed, marketed, the whole system. And it's going to take a lot of people working together, governments, the food industry, healthcare providers, and us, the consumers.
So it's not just about our own individual choices, but about working together and demanding better?
Exactly. We need to push for policies that support healthy food environments. We need to support businesses that prioritize fresh ingredients. And we still need to make smart choices about the food we're buying. It's all connected.
This reminds me of all those campaigns against smoking. Public awareness, policy changes, changing social norms, all working together made a big difference. Do you think we could do something like that with ultra-processed food?
Oh, I absolutely think we can. And it's not about feeling overwhelmed. It's about realizing that every little choice we make, grabbing an apple instead of chips or speaking up for healthier school lunches,
right,
it all adds up and makes a difference.
Like that ripple effect.
Yeah.
Okay, so this study focused on diabetes, right? But there's something else to think about here. Many of those things that link ultra-processed foods to diabetes risk things like inflammation, messed up insulin, even changes in gut bacteria are also linked to other things like heart disease, some cancers, even cognitive decline.
Right.
So wait, are you saying all that sugary stuff in those packaged snacks could be affecting our brains too?
We need more research, of course, but it's definitely something to consider. Reducing how much ultra-processed food we eat could have benefits way beyond blood sugar for our overall health.
Wow. Okay, you've convinced me. I'm ready to toss the processed snacks and embrace fresh food.
Yeah.
But where do I even begin? Don't worry, we're not going to leave you hanging. We wouldn't do that. We've got a plan.
Yeah, it's all about baby steps. Don't try to change everything all at once. Just pick one or two things you can swap out.
Okay.
Think about those ultra-processed foods you grab the most and see if you can come up with some healthier options.
Okay, so let's say my weakness is that sugary cereal in the morning. What's a good swap for that?
Well, instead of that, Captain Sugar Crunch, how about a whole grain cereal that doesn't have as much added sugar?
Okay.
Or even better, why not make some oatmeal?
Okay.
You can add fruit or nuts, spices.
Yeah, oatmeal is good. But what about snacks? I do love a good bag of chips,
Yeah, we've all been there.
Yeah.
Instead of chips, why not grab some fruit or a handful of nuts?
Okay.
Or how about some veggie sticks and hummus?
Oh, hummus. That's a good one. Okay, what about those nights where cooking just feels impossible?
I hear you. Life gets busy.
Yeah.
Even cooking just 1 or 2 meals at home each week can make a big difference.
Okay.
It doesn't have to be fancy, a simple stir fry or a one-pan roast,
Right, and cooking at home can be fun.
It is.
It's a chance to be creative, try new things.
Yeah, and it's a great way to get the whole family involved.
Yeah.
Everyone chopping veggies, stirring pots, making healthy meals together.
Okay, so we've got breakfast, snacks, and dinner covered. What about when you're on the go? Or just don't have time to cook, like those grab-and-go lunches or airport meals.
Planning ahead is key.
Okay.
If you pack your own lunch or snacks, you won't be as tempted by those ultra-processed convenience foods.
Right.
A little bit of prep work makes a big difference.
And what if I do end up at the store, staring down those aisles full of food?
Any tips for navigating all of that?
Yeah, become a label detective.
Okay.
Look for foods with shorter ingredient list, not too many additives, and less added sugar, salt, and those unhealthy fats. The simpler, the better, really.
So it's not about being perfect. It's about just making progress, right?
Exactly. Every little bit counts.
Yeah.
And don't forget, you're not alone in all of this.
Mm-hmm.
There are tons of people out there trying to make healthier choices and advocating for a better food system. That's good to hear.
Yeah.
Well, thanks for diving deep with us today. We hope you feel ready to make some changes. And remember, every time you swap that sugary drink for a glass of water or choose a homemade meal over something processed, you're making a difference.
That's right. For your health and the world.
Until next time, keep those ripples going.
Yeah.